I had an excellent experience, and I would rate the level of care to be excellent as well. I had a great outcome, and everything I expected to improve did, and even some things I didn't know would improved as well. I'm Kaitlyn. I pursued OMT therapy because I really wanted to make sure that I wasn't causing an issue with my tongue tie that was going to be difficult to beat over time. I was having some difficulty with chewing dense foods. I was having some headaches and some jaw grinding and clenching. And I was having difficulty opening my mouth wide enough at the dentist for care, as well as for my own self-care for my teeth to get like all the way back toward my molars without gagging. So it seemed like a worthwhile pursuit to make many things in my life a little bit easier.
I had the pleasure of meeting Kaitlyn and working with her after she was referred to me by her hygienist at her cleaning. Kaitlyn reported to me that she often had felt like her tongue just didn't fit in her mouth well. She didn't have a lot of space in her mouth when she was brushing her teeth. She explained that she would gag on her toothbrush just trying to brush her teeth, and she didn't really ever understand why that was abnormal. As I was working with Kaitlyn through her consult, we were able to identify that she had a tongue tie. And this tongue tie was causing a lot of dysfunction for her tongue, and a lot of the reasons why she wasn't able to move her tongue well within her mouth, and that was affecting how she was chewing and swallowing.
So I was referred from within my dental office when I was having a cleaning and having trouble keeping my tongue out of the way from the instruments. My hygienist said, "It looks like you might have a little bit of a tongue tie. Has anyone told you that?" And I said, no, nobody has told me that before. I did decide to pursue a screen, which, you know, I got to chat with Cindy in person. She got to take a look at my bite and how I swallow and talk about some of my symptoms to see if it would be a good fit for me. And I felt that that was a worthwhile endeavor.
One of the biggest reasons why Kaitlyn was able to have success is because she was able to have the frenectomy done. As I was working through her program, we weren't sure if she was going to need the frenectomy or not, but as we worked through the exercises, we were able to see that that restriction was definitely having an impact on the function of her tongue and how she was chewing and swallowing. I prepped her for the frenectomy, and then she had the procedure done with great success, minimal pain, and a really quick recovery afterwards.
I was a little nervous about like what a tongue tie release surgically would entail. It was nice to know that that's now a pretty simple procedure. I was in and out of the office in like less than a half an hour, including the time it took me to do paperwork. So that was allayed pretty nicely.
Another one of Kaitlyn's big concerns when I first met her was her nighttime sleep quality. She reported that she pretty much had drool on her pillow almost every morning, and she snored, and she would wake up in the middle of the night a lot and then have to reposition and go back to sleep. And so she was not getting good sleep quality or staying in deep sleep. And looking at her tongue and her rest posture and even just the airway and how the muscle was impacting that, it was causing a restriction.
I've also had a lot less frequent headaches. So I think, and I hope that I'm grinding my teeth less. I usually did in my sleep, so I wasn't sure. But I'm also not waking up in the middle of the night the way that I used to. And I think that that's because I'm sleeping with my mouth closed better. Because I don't have like a nice little drool puddle on my pillow anymore. So I do feel that sleep has been an improvement as well.
Kaitlyn's treatment went great. Kaitlyn is in the healthcare field, and so she was very knowledgeable about how the body works and very aware of her body, and that she just wanted things to improve and to be better, and she got those exact results.
I generally had all of my appointments with Cindy, and she was fantastic at coaching me through my exercises, making sure I understood them, checking in with me to make sure I wasn't having any issues, if I needed some extra time or cueing with some of my exercises to make sure that I was absolutely doing them right. That was provided to me without any pressure of like, nope, we're just gonna move on to something before we're ready. And it was nice to know that she's had lots of other patients go through with full rehab, including surgery or not surgery if it wasn't indicated, successfully with no adverse results.
Just hearing that she was able to do a better job keeping her teeth clean, her dental appointments are going more smooth because she actually can open her mouth bigger and actually be able to manage her tongue and not have it in the way because she had more control and it was stronger.
I definitely noticed that it's a lot easier to open my mouth wider to do my own flossing, brushing my teeth. I was someone that didn't even really want to use a mechanical toothbrush for a long time because it just felt so aggravating to have a larger instrument toward the rear of my teeth because I just couldn't open my mouth well enough to do that, which I didn't know wasn't a problem for other people. A process that was made very easy and organized so that it was an efficient flow to go through, and it didn't add any significant stress or crazy scheduling constraints to my day-to-day life. So it fit in really nicely and had a decent payoff in a lot of things that I was hoping to improve, and some pleasant surprises too.
Really excited for Kaitlyn with the results that she had, and it was a pleasure to work with her as well. If you think you or your child could benefit from therapy, please feel free to reach out to us at Cumberland OMT, and we'll be happy to answer any questions and provide a consultation and screening.